Basic prevention tactics for COVID-19. Reusable masks. Stitch together 3 layers of clean cloth and fix elastic bands to make your own masks. Wash them thoroughly with soap and water before using them. Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Orient which side is the top side to cover the nose completely. Ensure the proper side of the mask faces outwards. Place the mask on your face and pull down the mask's bottom so it covers your mouth and your chin completely. Do not touch the mask while you're wearing it for protection. After use, take off the mask by holding the elastic loops from behind the ears and keep the mask away from your face and clothes to avoid touching the contaminated surfaces of the mask. Wash the mask thoroughly with soap and water and dry it well. Wash hands with soap and water. Important note: be aware that there is a global shortage of medical masks, both surgical masks and N95 masks. These should be reserved as much as possible for healthcare workers. Difference between self-isolation, self-quarantine and distancing. Quarantine. Restricting activities or separating people who are not ill themselves but may have been exposed to COVID-19 to prevent the spread of the disease when people just develop symptoms. Isolation. Separating people who have contracted symptoms of COVID-19 and may be infectious to prevent the spread of the disease. Physical distancing means being physically maintaining a space of at least 1 meter between people. This is a general precaution that everyone should take even if they are not well and with no known exposure to COVID-19. Prevention is better than cure. Clean your hands frequently and thoroughly. Avoid touching your eyes, mouth and nose. Cover your cough with a band of elbow or tissue. If a tissue is used, discard it immediately and wash your hands. Maintain a distance of at least 1 meter from others. Disclaimer: this information is not a substitute for professional medical advice, diagnosis, or treatment. Please consult a doctor for further advice.